Welcome to TCN Talks. The goal of our podcast is to provide concise and relevant information for busy hospice and palliative care leaders and staff. We understand your busy schedules and believe that brevity signals respect. And now, here's our host, Chris Como.
Hello and welcome to TCN Talks. Our guest today is Mark Cohen. This is Mark and I's monthly show that I really do start to look forward to each month. Mark, it's definitely made me up my game in reading your actual hospice news today and kind of distilling what's coming at us. And Mark, I want to pivot a little bit differently this month as I cue you up. You've shared so many great stories about your wisdom, your experience. I'm a little bit of not a big art connoisseur, but some of the best painters are known after they're gone because people didn't realize the amazing art they produce while they're here. I kind of feel like that's you, man. People don't realize the amazing piece of art and what you do with this hospice news today. But as I've done this with you, I realize there's so much wisdom that you have. And so I think I'm going to start asking you each month. Maybe, of course, we're going into football season as well. So almost that halftime advice, wisdom that you would want to pay forward to hospice, palliative care leaders from your perspective.
Thanks, Chris. It's always a pleasure to be with you, and it's an interesting twist on how to start this month's podcast. My advice, I think, is, recognizing that hospices today don't have the same communications resources that they would have had 10, 15, 20 years ago. A hospice that had a VP level communicator 20 years ago, today maybe has a senior manager doing that job. And I see that reflected almost daily in the news releases that come across my screen for hospice news today. And I think I'll start with the advice, and that is if all you've got is a junior communicator, a mid-level communicator in your hospice, because that's all you can afford these days, there are ways to supplement that. Get a writing coach for your in-house writer, whether that's a volunteer, whether that's somebody from a local college, whether that's a retired PR person or a retired journalist. Kids coming out of journalism school today don't have the experience and they don't have the same level of education. I went to journalism school in the mid to late 70s. It was a time when Watergate had spurred a significant increase in journalism school enrollment. Although I had actually decided on a journalism major when I was in high school, a year before Watergate broke. Journalism school at that time, though, was a very different animal than it is today. The emphasis was on print journalism, not social media or broadcast journalism, and therefore good writing and effective storytelling were the keys. It was an era when your instructors were burnt-out journalists and burnt-out editors, and so they would do things like throw erasers at errant writers, rip up your copy in front of the whole class, stand in front of the class on the first day and say, this is tougher than you think it is. Half of you will be gone by the end of the semester. And they were right. I even witnessed a professor pick up a manual typewriter from a student's desk and dump it in a metal wastebasket, just to make the point. You either learned how to write quickly and correctly, or you were soon looking for another major. And so it really pains me today to see so many poorly written news releases come across my screen as I put together hospice news today each day. News releases with lead sentences that are written in the passive voice. Heck, half the release sometimes is written in the passive voice. An example, memories were shared and tears were shed at the 15th annual butterfly release by XYZ Hospice. Another problem, news releases that begin with the least important fact, which 9 out of 10 times is the time element. Today, memories were shared and tears were shed at the 15th annual butterfly release by XYZ Hospice. Lead sentences like the entire news story or news release generally should be written in what we were taught as the pyramid style of journalism. Most important fact first, subsequent facts cascading from the most important to the least important. Time element is almost never the most important fact in a news story, but it so often leads the news releases I see. And then there are the words I see in releases that simply have no meaning in a press release, and they have no business being in a press release. Words like excited, thrilled, proud, pleased, and the like. As an editor, I simply do not care. Feelings, as a general rule, are not news. And in a similar vein, inexperienced writers strain to use words to attribute simple facts. So they'll say that he shared or she expressed a simple fact. And that is just simply ridiculous. Expressed is what a veterinarian does to your cat's or dog's anal glands at a regular checkup. It is not a word that is used to describe the recitation of a generally known fact. So why does all this matter, except to me? It's unprofessional. And there are still enough old-time editors out there at newspapers and in broadcast centers that you ought not to risk their wrath with a crappy news release. So again, I go back to how I started. Find the writing coach to help your writers. You probably don't have an editor in-house, but find somebody outside the organization who can help your writers. It really will pay dividends. Here's a final hint. You can tell what I think of a badly written press release in hospice news today, because I will go out of my way to minimize the amount of copy that I use from a badly written release, because I choose not to reward bad writing.
Well, Mark, gosh, that's priceless. We're going to have to pay that forward to a lot of the different marketing departments that we have and communication departments throughout our network. You probably don't know this, but you've provided coaching to me, not maybe overtly, it's just who you are. I'm now writing my first book, and so there's a couple of pearls I've gleaned along the way, and I just know I'm going to bring my A game with you. My mom would probably laugh and go, Chris is bringing right grammar and actually getting more precise in his writing, knowing having grown up in South Louisiana, not exactly my strong suit. It's more kind of doing what we're doing right here in the podcast. So thank you for the gift of paying that forward to me. I know it's made me a better writer. And I think that if a lot of folks will go back and listen to what you just said, that's like a master's class just now on actually good communication and good writing. So you ready to jump in? So Mark, as I was doing my review, I have a perception that the volume of articles went up pretty tremendously this month. Was that an accurate perception?
I think it was. It was more than just pure hospice stories, also news subjects on the periphery of hospice throughout the post-acute continuum. Huge number of stories, beginning with long-term care, assisted living, and senior living, which had a record number of articles in hospice news today in August, 74 articles that I ran in the past month about those topics. And, there's good news, bad news there. The good news is that there were 74 articles about long-term care, senior living, etc. The bad news, most of the articles were negative. Focus on quality issues, labor problems. They both gave closures and bankruptcies a run for the money in August in terms of the sheer quantity of news articles. It is worth noting among the positive reports were news reports that said that census is continuing to slowly rebuild from the depths of the pandemic. But once again, not a great month for long-term care, assisted living, and senior living, unless all you're doing is counting clips. General hospice news, with a lot of focus on public policy and regulatory issues, generated 52 articles that I ran in hospice news today in August. Perhaps the biggest news, I think even bigger than the Medicare payment update, was the news that CMS is considering, quote, administrative action, unquote, against 400 suspect hospices following a lengthy review of each hospice location. The media continue to refer back to last December's ProPublica investigation on fly-by-night hospices, with repeated references in news coverage of possible reforms. And there was an absolutely scathing column by Dr. Ira Byock in Stat News that said that the first thing hospice should do in terms of reform is apologize for the abuses wrought by the corporatization of the sector. On the other hand, news about hospice community-based and mission-driven providers came in third place last month with 43 articles, a distant third place, but still a large number of articles. As in months past, opening, closing, and new construction of inpatient units was the biggest news, although the month ended with an article about the 50th anniversary plans of Connecticut Hospice, the nation's first hospice. For-profit providers were right behind in fourth place with 42 articles in August. August is earnings season, so stories about the numbers of publicly traded hospices dominated most of the coverage in August of for-profit providers. The month ended, however, with a bit of a bang as the relatively new Encompass Health spinoff, Inhabit Home Health and Hospice, announced it was buckling to pressure from an activist investor and will begin to examine strategic opportunities that could lead, emphasis on the conditional, could lead to a sale or merger. And right behind that, in fifth place, was labor and employment news with 40 articles in the month of August. Most of the articles were about strikes, threats to strike, labor settlements, votes to unionize. The most interesting series of stories in the post-acute sector in terms of labor news came from Maine Healthcare at Home, which administration fired a couple of nurses allegedly for disciplinary reasons, and that caused the unionized nurses at Maine Healthcare at Home to vote no confidence in management. And the whole thing played out in their local daily newspaper in Portland, Oregon. You begin to see a bit of a drop-off after the top 5 categories. M&A News had 32 articles in the month of August. Hospice got its fair share, mostly regarding the Department of Justice, asking for more information about the pending Optum Amedisys merger. Also of note, if you read between the lines, we got the final results of the sale of the former not-for-profit Hospice of Chattanooga and its affiliated hospices to a for-profit hospice in Virginia, with the spinoff foundation created by the sale of those not-for-profit assets receiving $103 million. So article didn't say so, but I think you can assume that all the bills have been paid, all the settlements have been settled, and the folks who ran the hospice, who now run the foundation, have $103 million with which to play. In the post-acute structure, in the broader post-acute sector, struggling Tabula Rasa, the pharmacy provider and innovator, announced that it is going private after several years of bad financial news. Seventh place was grief and bereavement news. There were 30 articles. August is a great month for butterfly releases and kids' grief camps. They certainly dominated the coverage of grief and bereavement. There were a couple of stories in a column that were of note because they were about the summer concert tours of Bruce Springsteen and Beyonce, both of whom are featuring original songs that speak to grief and recovery as part of their concert sets. And they touched a number of people out there who mentioned it in their local media coverage of those concerts. Hospital News was in 8th place with 28 articles. Bankruptcies and closures dominated hospital coverage again in August. There were also several articles that focused on the continuing, or is it the growing, threat of mass closures among rural hospitals. And as hospice providers, it's always worth remembering that when a hospital closes, the local hospices can see a significant decline in timely referrals. In fact, the entire remaining local health provider community usually suffers when the local hospital closes or significantly downsizes. 9th place for me in terms of sheer quantity were stories about end-of-life care and palliative care. There were 26 last month. The largest number of those articles focused really on the cost savings and the efficiencies that result from palliative care. And nice to see, if you're a not-for-profit, the 10th category with 23 articles was fundraising and development news. The usual array of stories about fundraising events, foundation grants, corporate gifts, which stories also included a couple of rather sizable grants for local hospice providers. And there were also a couple of articles about hospice thrift shops, which can generate a lot of income for the hospice they support, and which can drive for-profit providers crazy because of the branding and the market penetration and the goodwill that thrift stores can generate. The pretty steep fall off to the honorable mention for the month of August. The next half dozen categories were physician and nursing news, home health and private duty news, wish and dream fulfillment stories, dementia care news, which saw 10 articles, which was pretty significant. Huge drop-off with physician-assisted suicide, medical aid in dying, only 9 articles. Legislatures are out of session, and so the article, this issue is getting a lot less attention. Elder news and aging care news brought up the rear for this half dozen of honorable mentions with 9 articles. It's worth noting that medical marijuana has fallen off the charts, again, because state legislators have largely ended their work for the year, and not making the honorable mention, but still significant. There were 5 articles in the last month about Jimmy Carter's hospice journey, and they were all compelling, important, and affirming. So that's my take on it from a quantitative point of view, Chris.
You know, Mark, something occurred to me this month I've been wanting to ask you. In your actual hospice news today, you have kind of like a summary at the beginning, like in this issue, and then you've got a title and then kind of a little bit of a paragraph or so explanation. Do you choose that title, or is that always generated by the actual title of the article?
Well, the categories I chose as I developed the newsletter, and so that is that's what the articles fall under. But the contents listing is just a pure top to bottom list of the titles of the articles.
Okay. And then the summary is that kind of your summary or kind of an extrapolation?
That's an extract from the actual articles to give people a hint of what's in there in case they want to click on the URL or open up the PDF and read more.
So what struck me this month is just how masterful you are. And I think we've lost the art of what's the point? Get to the point. What is the meat? And it just hit me this month that I don't know if most people realize that, but as I've now spent so much time in this with you, that is the gift. And that's also the wonderful value that you're providing on what you're doing. Because as I go through and kind of segment all the different articles, it just starts to strike me as, number one, the title, but then number two, that explanation. You get the gist of it. And we do live at a time you've got Blinkist and all these other tools where they're trying to extract the essence of a book, etc. You've mastered that as far as news articles. So I just want to pay that forward to you because it just hit me this month that is part of the gift that is Hospice News Today.
Yeah, I learned that doing news summaries for almost 10 years for Vitas. I knew that our senior staff were too busy to read everything, so I tried to come up with a system that would let them skim the news quickly and pay attention to that which was of interest to them. I would tell folks that I don't expect you to read everything. You don't have to be the smartest person in hospice. You just have to be the smartest general manager or medical director or sales director or chief nursing officer in your particular market.
Thank you to our TCN Talks sponsor, Delta Care RX. Delta Care RX is also the title sponsor for our May and November 2023 Leadership Immersion courses. Delta Care RX is primarily known as a national hospice, PBM, and prescription mail order company. Delta Care RX is a premier vendor of TCN and provides not only pharmaceutical care, but also niche software innovations that save their customers time, stress, and money. Thank you, Delta Care RX, for all the great work you do in end-of-life and serious illness care.
Wow. My mentor, Mark, I think I've mentioned to you before, he was actually Stephen Covey's mentor, a gentleman named Dr. Lee Thayer, and he taught a concept which we teach now in Telias. We model it with our team as the concept of need to know. And really that's what need to know is what you've modeled is what's the essence of what you need to know from this. And that is a skill that if it's woven into the culture of an organization, number one, you'll be much more efficient. But number two, you will be focusing on the things that which you need to focus on. And I think that really gets to the essence of why you and I do this each month. So let me jump in now, Mark, from the perspective of, love how you do it quantitatively. Mine's from the C-suite. Here's the things that I hope you didn't miss this past month. And so my top 10 themes, there were 73 articles this month. The last time I think I had this many articles flagged was probably about March or so. So I always start with Mark when we're doing our pre-show prep. I'm like, okay, here's my perception. Does this kind of jive? And Mark affirmed it did. So the first one that I flagged, Mark, was the present quarter articles. And again, you've had the privilege of being on his administration. It's where you've honed some of these skills. I've been giving you a good shout out for this morning. But the fact that he's still alive in 6 months, the gift of that, because just who he is, a former president of the United States, and then changing the perception that hospice does not mean you're dying tomorrow. And here he is 6 months later. So there were several articles. Back a fitting final gift from Jimmy Carter is one of the ones. I just love the way that was actually framed. President Carter reaches 6 months on hospice care. Oldest living president redefines hospice care. So just some really great articles giving a shout out. And again, I've said before, my favorite movie is The Secondhand Lions. Being used up in this life. And here's President Carter making an impact even at the very end of his life. And just major kudos to him and just his family, and we will continue to pray for them and wish them all the best. The next category was the hospice regulations that you actually called out. There's actually a Fortune article that I put in that category. Does Medicare cover hospice services? Yes, and here's exactly what it pays for. I think I theorized and dreamed about days that hospice would be covered in Fortune when I started at the age of 25 and used to subscribe to Fortune. So I think at some level that's interesting that we've kind of been noticed in that way. But then lots of articles. CMS threatens to cut hospices from Medicare if they can't prove legitimacy. Nearly 400 hospices are considered for administrative action as program integrity efforts. Hospice advocacy groups call on CMS to delay revised special focus programs. So the SFP is probably an acronym, C-suite leaders that you're going to hear going forward. Hospice industry group, CMS must reform the auditing processes. Hospice news providers to lawmakers. Hospice is a huge value to Medicare. And then NHPCO, this was a news release, 6-month update on hospice program integrity recommendations. And then again, Dr. Bayak's article about the hospice industry needs major reforms. It should start with apologies, which prompted me, Mark, that is going to be our first show of 24. It's going to be with Dr. Ira Bayak, so that's going to be a pretty cool show. The next category really had one article, but I just wanted to call it out to leaders. NHPCO, so NOC and NHPCO inch closer to possible combination. That's pretty big for our segment. And next one was a Hill piece. The price of elder care soars as demand increases and the baby boomers age. So that silver tsunami demographic, hopefully by now everyone has that very pithy way of encapsulating that, because that is going to change our world over the next 15 to 20 years as we're shifting from having care for the greatest generation to the baby boomers. The next category, I kind of grouped several articles. Would call it value-based care, Medicare Advantage, alternative payer models. And so ACO programs have saved Medicare $1.8 billion. I think we're about ready to get into a season where ACO programs are going to be a little bit more open to partnership with what I call serious illness providers. A McKnight's article, what exactly is value-based care? Many employers and consumers don't know from a study. Which is interesting considering how many people are actually saying that, value-based care is going to be 100% by 2030. Medicare Advantage, another article, Medicare Advantage linked to less favorable outcomes and also reduced post-acute use. REACH ACO, so the ACO REACH will change in 2024. There's some pretty, we call them substantial, but some changes as we go forward with REACH ACO, which actually has had some success. And then another article about VBID hospices operate in a teeter-totter landscape. So that was a really interesting article. Another article about cost control. So hospices, true north and Medicare Advantage. And so talking about hospices being carved into hospice Medicare Advantage. And then nursing home investors on the sidelines amid higher interest rates, less stable skilled nursing facilities, which kind of leads to kind of one of the next categories that I had actually, Mark, and I think you called that out as well. There were several articles and kind of storm clouds on the horizon. I can remember being hospice CEO and wondering, at some point, are we going to encounter some pretty stormy waters for skilled nursing facilities? And it sure feels like those are here now. So several articles, healthcare bankruptcies are skyrocketing, but not yet in home-based care, but really referring to skilled nursing facilities. Access to care, number of Medicare-certified home health agencies continues to fall. An Axios article, operating margins improve, but hospitals still face high expenses. And that was kind of quoted from Kaufman Hall. This year will not bring a full rebound to nonprofit hospitals. So we're talking about hospitals and skilled nursing facilities. Skilled nursing sectors growing or shrinking problems get new attention. And Mark, this is one, not only was in your hospice news today, but you and I had an email exchange with a mutual friend in rural America. 30% of rural hospitals are at risk of closure. That is pretty daunting. And as you were saying, just the impact, if that actually goes, if that happens, and the impact on local healthcare landscape. Nursing homes, hospices, and other businesses are sold as hospitals are refocused. Mark, you've probably seen that throughout your career. I saw it in my career, kind of post 1995. Hey, let's bulk up. Oh, no, bad idea. Let's now go ahead and divest of a whole bunch of that. So I think we're going to see a lot of that in the next 24 to 36 months. Again, rural hospitals feel the squeeze of Medicare Advantage. Skilled nursing news, almost half of nonprofit providers scaled back construction on new SNF projects. And then Wall Street Journal, the upheaval at America's disappearing nursing homes in charts. And there's a pretty fascinating chart in that article. So my next category was I call mergers and acquisitions. Lots of movement where people maybe in the past we wouldn't have thought kind of moving into healthcare. But Best Buy, there was an article about Best Buy grows in home care presence with assistant services. Of course, CVS Health reiterates commitment to driving more at home care in the United States. Then a couple articles about the whole United Healthcare and Amedisys. So the Justice Department is providing more scrutiny because of growing antitrust concerns. Article from the New Orleans Advocate, how United Health Group wooed Amedisys into breaking up with Option Care Health. And then another interesting article, and it just really caught my attention because I literally had an interaction with a primary care practice in another state that sold out to private equity, and he said it was the worst decision of his life, destroyed his practice. But the article was in Time, what happens when private equity buys your doctor's office. So that was kind of the next category. And then palliative care, there's several good articles, how palliative care generates savings and boosts hospice utilization. I can remember the days we dreamed of kind of being the pioneers at Four Seasons where you get some great press coverage about palliative care basically saving money to the broader healthcare system, and now we're getting some good coverage. Why MA plans are investing in palliative care as a supplemental benefit. That's one that caught my eye. And this was an interesting one. The U.S. prison system is struggling to keep up with the growing need for palliative care. And then kind of rounding out my top 10, staffing is always, Mark, we're probably, it's going to probably never be a month where we don't call it out. And this probably was the largest volume of articles. And I'll try to cite just a few because I think I've got like 20. But Senior Living Court approves class action status for ALF staffing lawsuit. U.S. women miss out on $627 billion by not getting paid for caregiving. I kind of put that in the staffing category. Why we need more resources for caregivers, especially those for immigrant families. Everyday People, nurse finds new purpose in hospice care was a really good article. I thought of kind of, hey, this is some very purposeful work. Image of nurses as healthcare heroes is daunting and inspiring to students. New Medicare proposal would cover training for family caregivers. Healthcare workers at high risk of drug overdose. I thought that was kind of interesting. Healthcare employment rate rises, but providers still anticipate hiring difficulties. There's a Modern Healthcare article, staffing shortages may worsen again, and here's how hospitals are preparing. And then as healthcare moves into the home, do we have enough workers? Yeah, definitely not. HHS invests $100 million to bolster the nursing workforce, preparing the next generation for nurse leaders. Nursing shortage is tied to burnout. 50% of nurses have a side hustle to earn extra income. So just a lot of articles in that category. And then my kind of honorable mention category, there were a couple articles about death doulas. Mark, you were really kind of one of the ones kind of maybe put that on my radar screen. This is one that was interesting. Everyone dies. End-of-life doulas can help us process it. And there was another one about, can a death class make life more worth living? And these students think so. It was about death doulas. A couple articles about dementia care, and maybe I'm just a little bit more attuned to that. We're going to do a show on dementia as we get towards the end of this year. So there are a couple about college students change the lives of people with dementia. CMS involves a program to improve dementia care and ease unpaid caregiver strain. And then an article, so kind of shifting to another category, the average cost of healthcare data breach reaches now $11 million. That's another theme that we've called out on this show. And then the article you mentioned, Mark, how Bruce Springsteen and 18,000 Strangers helped me mourn my mom, was a great article. Another interesting article as far as a niche, Florida's first LGBTQ and centric assisted living community actually opens. And then a Cumberland couple's hospice care is ended, but their need for it is not, and really kind of bemoaning being discharged because, the patient's not declining. And then an article in the USA Today about I'm a doctor, so is my mother. When she got cancer, I realized how little that mattered than just which is interesting coming from a doctor to say that, but it was a very touching article. And then one again you put on my radar screen that I watch for, Mark, senators push the IRS to launch nonprofit hospital probe. That's one we're going to have to continue to watch. And then in the New Yorker, the hidden harms of CPR. And then human composting. Mark, I was looking at something last night. So the article is turning dead bodies into soil. There's a fascinating, I don't look at social media very often, and I almost screenshot it. But it took all these futuristic movies and it put what year the futuristic movie, and where we're pegged right now was Soylent Green. And I thought, I don't think that's a good thing. And it actually went all the way into 2300 or something like that. And then the last one that I had to call out, my good friend Carol Fisher, who's the president of MPHI. Carol Fisher hosts Global Trending True Crime podcast, The Girlfriends. Carol's been number one in the U.S. and the U.K., which she's such an amazing human being, and spent the vast majority of her life in hospice and palliative care, but also calling out just domestic abuse and just using this podcast as a beautiful platform. And so that's mine. Mark, any final comments from you?
The diversity of issues that have an impact on the C-suite really speaks to the need for healthcare leaders, hospice leaders to get out of their tall, narrow silo and look over the edges of it and see what is going on outside of the four walls of their particular provider business. And this was a great month to make that argument. And it makes the argument that if you're not doing this on your own or subscribing to Hospice News Today, your competitors who have a significant advantage over you. That's well said, Mark. In fact, that's probably something that I would definitely want to highlight this month. We had a couple of people ask and say, hey, how can we get a copy of the articles that you and Mark actually cite? So in the summary that we put out with the podcast, you're going to have my email, Mark's email. Email either one of us. We could get you a list of the articles, and most importantly, Mark can get you actually subscribed to Hospice News Today if you're not. I strongly recommend it. I don't know how I could do my job if I did not. And if I was a hospice CEO or any C-suite leader, this would be required reading on a day-to-day basis. I do it before I hit my 8 o'clock each morning. It's kind of one of my last things as I have in my morning ritual. Get that, gives me a framing for the day, and then I'm off to all my tasks for the day. So Mark, thank you for the service that you continue to provide to the hospice and palliative care segment with the work that you do. Happy to do it, and happy to be on the podcast. All right, so I'm going to close with this quote, ran this one by Mark, and so my daughter loves Dwayne "The Rock" Johnson. So from The Rock, when you focus on you, you grow. When you focus on shit, shit grows. Thanks for listening to TCN Talks.